Republic Act 7600, also known as Breastfeeding Act of 1992. RA 7600, known as the Rooming In and Breastfeeding Act of 1992, was enacted to promote breastfeeding and rooming in practices in the Philippines. The law encourages and supports these practices in both public and private health institutions to enhance maternal and infant health. In a global context, breastfeeding is widely recognized as the ideal way to nourish infants, offering numerous health benefits for both mothers and babies. However, factors like marketing of infants, formula, and cultural practices can influence feeding choices. In the Philippine context, breastfeeding promotion was a growing concern, leading to the passage of RA 7600 to establish a legal framework for supporting breastfeeding and rooming in. Mandatory rooming in and breastfeeding. Health institutions are required to have rooming in and breastfeeding arrangement in place. Breastfeeding rights. Mothers have the right to breastfeed their infants. Informed consent. Bottle feeding is only allowed if the mother, after being informed about the benefits of breastfeeding and formula feeding, chooses it in writing. No promotion of breast milk substitutes. Health institutions are prohibited from displaying or promoting breast milk substitutes. Promotion of breastfeeding. The Act aims to encourage and support breastfeeding as a preferred method of infant feeding. Protection of breastfeeding. It protects mothers' rights to breastfeed and prevents the promotion of breast milk substitutes. Health and welfare. The Act prioritizes the health and welfare of mothers and infants by promoting breastfeeding. Collaboration. The Act encourages collaboration among government agencies, professional organizations, and non-governmental organizations to implement the provisions.
Purpose and relevance in Philippine society. The purpose of RA 7600, the Roaming In and Breastfeeding Act of 1992, is fundamentally to promote, protect, and support the practice of breastfeeding in the Philippines. Its relevance in Philippine society is significant and multifaceted. First, improved infant health. Breast milk is widely recognized as the ideal food for newborns and infants, providing essential nutrients, antibodies, and immune factors that protect against infections, allergies, and other health problems. RA 7600 directly contributes to better infant health outcomes, reducing infant morbidity and mortality rates. Second, maternal health benefits. Breastfeeding also offers numerous health benefits for mothers, including a reduced risk of postpartum hemorrhage, faster uterine involution, and a potential decreased risk of certain cancers and type 2 diabetes. By promoting breastfeeding, the law indirectly contributes to improved maternal health. Third, right to health and nutrition. The law upholds the right of the child to the highest attainable standard of health and nutrition, recognizing breast milk as the cornerstone of infant nutrition. Next, reduced health care costs. By promoting breastfeeding and improving infant health, the law can lead to lower healthcare costs associated with treating infant illnesses. Sixth, normalization of breastfeeding. The law has played a crucial role in normalizing breastfeeding as the natural and optimal way to feed infants, helping to counter the aggressive marketing of breast milk substitutes. Seventh, increased awareness and education. By requiring health institutions to educate pregnant women about breastfeeding, the law has contributed to greater awareness and understanding of its benefits among families and communities. Its impacts on different gender sectors. First, women, specifically mothers. Empowerment and recognition of maternal role. The law recognizes breastfeeding as a crucial aspect of motherhood and empowers women by affirming their right to breastfeed and their child's right to their breast milk. This can contribute to a greater appreciation of the mother's role in nurturing her child's health. Increased demands and responsibilities. The law places the primary responsibility for breastfeeding on mothers. While it aims to support them in societies where child care and household responsibilities are not equally shared, this can add to the existing burden on women. Overall, RA 7600 has a significant gendered impact, primarily centered on women as mothers and infants of both genders. It aims to empower mothers in their breastfeeding journey and ensure the health rights of infants. While the law itself doesn't explicitly address gender equality in the broader context of child care responsibilities, its focus on supporting breastfeeding has spurred further discussions and legislation that attempt to address some of the challenges faced by working mothers. It also implicitly encourages a supportive role for fathers and necessitates the involvement of healthcare professionals across all genders.
Real-life application. First, hospital policies and practices. R 7600 has led to significant changes in hospital protocols. You'll often see newborns placed immediately with their mothers after birth for skin-to-skin contact, and the early initiation of breastfeeding within the first hour for normal deliveries or within 3 to 4 hours for cesarean deliveries. This is direct result of the law mandating rooming in. Second, increase breastfeeding rates. While multifaceted, the implementation of R 7600 has contributed to increased awareness and promotion of breastfeeding as the optimal infant feeding method. By encouraging early initiation and exclusive breastfeeding, the law supports better health outcomes for infants and mothers. Third, reduce infant mortality. Breastfeeding is linked to reduced infant mortality and morbidity. The Act indirectly contributes to this by promoting optimal breastfeeding practices. Studies showing decreased infant infections in hospitals with robust rooming-in programs illustrate this positive impact. Challenges in implementation. First, inconsistent enforcement and monitoring. One of the significant challenges lies in the consistent enforcement and monitoring of R 7600 across all government and private health institutions. Compliance levels can vary, and ensuring that all facilities adhere to the mandated rooming-in and early breastfeeding practice remains an ongoing concern. Second, lack of resources. Many healthcare facilities, especially in underserved areas, lack the resources to fully implement rooming-in. This is especially true in public hospitals with limited budgets and overcrowding. Third, cultural practices. Some cultural beliefs and practices may conflict with rooming-in, requiring sensitive approaches to education and awareness campaigns. Traditional practices prioritizing separate care for newborns needs to be addressed. And last, privacy concerns. Balancing on benefits of rooming-in with mother's privacy concerns require careful consideration of room design and hospital policies. Concerns about shared rooms and potential disturbance need to be addressed.